Hello, I'm Patrick Daly and I'm one of the team at the Rural Doctors Association of Australia. Each year, RDAA and the Australian College of Rural and Remote Medicine offer excellence awards that recognise some outstanding rural generalist doctors and some inspiring future doctors as well. I've been lucky enough to spend time chatting with 4 of our awards recipients for 2021 for this podcast series. Today's podcast features Dr James Padley, the ACRRRM and RDAA Rural Registrar of the Year for 2021. James is a rural generalist doctor who works with the Royal Flying Doctor Service at Port Augusta in South Australia and is also known for his compassionate mentoring of medical students and junior doctors. Before I begin talking with James, I'd like to acknowledge the traditional owners of the land we meet on across Australia as we listen to this podcast. I'd also like to pay my respects to elders past, present and emerging, and welcome any Aboriginal and Torres Strait Islander listeners who may be joining us. James, thanks very much for joining us today and congratulations on receiving the ACRRRM-RDAA Rural Registrar of the Year Award for 2021. What did it mean to you when you found out?
Oh, thanks, Patrick. Yeah, thanks for having me. And look, really humbled to receive the award. I know many other hardworking registrars and doctors in rural towns in my experience and career, so I was really humbled to be nominated and to receive the award. But look, I'm really excited. I think it's a wonderful recognition, and we don't always get recognised for the hard work we do.
So tell me a little bit about your childhood. Where were you raised?
Yeah, so I'm from the East Coast. So I was raised in the Southern Highlands of New South Wales in a little place called Welby, which is near Mittagong and Bowral. So your listeners may know, and it's a lovely little place. It gets a bit snowy in winter. But it was quite quiet back then when I was growing up, and we moved around a bit, moved to the Central Coast, New South Wales, which was lovely. So I spent primary school by the beach.
Sounds
and
good.
Then mum's originally from, it was good, yeah. Mum's originally from Scotland, so she took us over to the UK. So I did most of my high school in the UK. Again in a sort of a small rural village, and came back year 11 and finished high school in Sydney.
So you obviously had an upbringing in rural Australia. Did you get some interest in rural medicine or get some exposure to rural medicine at that time, apart from going to visit the doctor yourself?
Yeah, I did. I think I had a mixed sort of exposure. My dad was a builder, so I often was around building sites a lot, and there's lots of pictures of me as a kid running around naked around bulldozers and things, which was a bit odd, I suppose, but grew out of that. And then mum's a nurse, so and she was trained in Mudgee and Bathurst, and I always remember listening to her stories, and she was spent a lot of time in theatre as a surgical scrub nurse for the rest of her career. So I always loved hearing her stories about the banter that goes on in theatre, and obviously helping patients, and a lot of that was about times when she was working in the country. So I think it did rub off for sure.
So was the plan from early on to become a rural doctor, do you think?
Look, no, to be honest, I think like a lot of things in our careers and medicine particularly, I don't think there was no clear path for me at that stage, and the path is very rarely linear. So I think I started out at uni. I applied to the Air Force actually when I was 18. I wanted to be a pilot. Like every good 80s child, Top Gun was the favourite movie, and I wanted to do that. So I remember the interview, I didn't quite get through. I got through some of the tests, but the guy, they give you a psychological interview, and he sort of said, "Oh, what else would you do if you didn't get in?" And I remember saying at that time, "I think I'll do medicine." That was certainly in my mind as well.
So the journey moved on, and I'm assuming you didn't get into the Air Force, but you chose medicine as the career option?
Yeah, so it's amazing, isn't it? Those sliding doors. But I did medical science, so I didn't quite get the marks I needed for medicine. But I did medical science at Sydney University, and I actually loved it. The first year wasn't the best student, but then I had a really inspirational teacher who was a neuroscience teacher, and he really inspired us to sort of question why and ask questions, and ended up doing a bit of research after medical science. And did a research degree, and then later on realised that I wanted to get into medicine.
And initially, as I understand it, you were looking at becoming a specialist anaesthetist. So you undertook your registrar years in anaesthetics and ICU before making the move over to rural generalism. How did that change in journey come about?
Yeah, so I guess it has been a really, really interesting journey. On my junior doctor years, I think it's really interesting because a lot of students I talked to, and particularly myself at the time, you never really know what it's like until you get into it. And I remember doing some terms, and we couldn't do a lot of anaesthetics until sort of 2 or 3 years into it. But I remember my first time in theatre, I thought, I love this, and I thought I really want to give this a go, and had some really supportive mentors at the hospital I was at, which was St Vincent's in Sydney, which is a big hospital, sort of big tertiary hospital, does a lot of complex stuff, and followed that path and did 2 years of registrar training there before a few changes. But I think at the time I remember as well thinking that I wanted to get some skills, and I think that's really important as well. When you're a junior doctor, you want to be able to handle things, and getting those skills early on has been a really important feature of sort of where I've gone since then.
So what changed your career path into rural generalism? What was the moment at which you went, yeah, this is what I want to do, as opposed to becoming a specialist anaesthetist?
There was a few things, a few turning points, I guess. When I was a student, I did some rural placements that really opened my eyes. There was a couple. One was with a GP in New South Wales in Dungog, a lovely guy called Dr Duncan Dew, who's still there. And he was a really, really great guy. And I always loved the way he interacted with his patients and his manner. And that was something that was really, when you think back to sort of what you remember as a student, there's not that many things, but that really stood out to me. And I also went to Arnhem Land for an elective. And again, that was incredibly eye-opening, having spent a lot of time as a student in Sydney, and then all of a sudden to be in a place where there's a lot of traditional culture and an incredible eye-opening experience. So I was always there, and I also did a term as a junior doctor in the Solomon Islands, where again experienced what it was like to be a sort of rural doctor essentially in the middle of nowhere. And I think again what stood out to me then was I wanted the skills, and so I kept going with anaesthetics. But eventually we moved to Adelaide, and that was about that time where we had some changes, and I had a bit of time off and did some locum work, that I really sort of started to think I wanted the variety, and just anaesthetics, if I just went down that path, something would be missing for me.
And of course, I'd imagine you saw rural generalism as being able to give you the ability to work as a GP anaesthetist as well.
Exactly, yeah, I remember doing that. So I went literally from a tertiary trauma hospital in Adelaide, and then had a break when we had our second child over here. And one of the locum work I did was in Kangaroo Island, and it was just a few days, but in those short few days, having gone from managing airways and things like that in a tertiary hospital to being able to sort of have to manage anything that walks through the door, and seeing the skills of the local doctors who could do that. And it wasn't just about the anaesthetics, but it was also about the primary care and the general health and emergency. That to me was just, wow, there's people out there doing that, and I thought that was something for me.
And do you think the humanity of general practice and rural generalism really stood out to you? Because I know that you love the science part of medicine and love learning about that, but you ultimately came to see medicine as being more about people. Do you think general practice is really where you see that element of medicine coming to the fore?
Yeah, absolutely, Patrick. I think there's sort of various phases you go through in your career, I think, and I certainly started out with a love of science and physiology, and I did a lot of research in physiology. Loved how the body worked, and I think it became a few experiences, particularly seeing how rural GPs operate. I just love the way their humanness, and they were able to, the manner with the patients. It really stood out to me, and it's sort of, I remember even going back to my GP in Dungog. The way they dressed, they just looked relaxed. I think he wore Crocs into the practice, and
Right.
his patients loved him, and there was that element, they were able to open up to him. And I think that, having gone through a lot of sort of experiences now, I think that's really stood out to me, that rural practice is certainly about the patient and trying to understand them, whereas that does get missed when you're in a big hospital, where it's more about the disease process or whatever label you give things. And I think I've really tried to keep that in my own work, but that stood out to me. And as well as that, being able to be human as a doctor in rural practice as well, and your patients see that, and they know you in other contexts. I think that's really important as well.
Do you think, having grown up in a rural area, that undertaking those initial placements in a rural location made you feel a bit more at home as a medical student in terms of how the doctors communicated with you?
Absolutely. When I work with students now and I talk to them about rural placements, I tell them that your supervisors are going to know your name. And that's not, in the city, often they won't even know who you are. They're sort of at the back of the pack. So that's certainly something that I tell students who are going to be going out to rural places, and certainly something I experienced. Even going down, and having a coffee or a beer at the end of the day with a doctor if they've got if they're not on call, obviously. But
Yes.
that chance to do that when you're going through and to see that other side, and to talk one on one with people who are working there, I think it's so valuable.
So I guess I'm interested in your role as a medical educator. You've held senior rural medical educator roles with Flinders Uni and now with Adelaide Uni, and those who nominated you for the award highlighted your commitment to mentoring medical students and junior doctors. Do you think your early experiences with rural clinicians shaped your desire to teach and mentor students, and how have you brought that into your own teaching?
I think it's always been with me, in some way. That even before medicine, I was doing some teaching when I was a research student, and I was actually a PBL tutor for the medical students, which is a bit odd because often you don't need the medical training, but you need to be able to sort of work with a group and highlight a group, where they're going with an idea, and how to help them stay on track. So that was those skills you can bring without always the medical training, and really it was just about sort of helping people gain insight and understanding, and getting the best out of them. So I certainly always enjoyed that, and likewise going through, as I mentioned before, you really remember the teachers that affected you. You can sort of, I'm sure all the people out there can remember that one teacher in high school, or that one key figure through university, and I've got that person as well. And likewise in medicine, you remember those one or two people who had an effect on you. You can't always pinpoint it, but it's so important. As well as that sort of practical element of how things work, or how you operate in an environment in medicine. It's about someone demonstrating some support or kindness, or listening. And so I guess those things I've kept with me, and I really try to do that with students that I've sort of been involved with at Flinders Uni. They've got a great program called a Learning Coach, which is sort of helping students as they progress through each year, just to identify sort of where they're up to, and I think it's so valuable. And likewise, Adelaide University has mentor programs in a similar sense that I've been developing. So and certainly in rural contexts where students are in a rural area for a long period of time, they get to know their supervisors, and the supervisors can mentor them through the process, as well as giving them practical and clinical skills.
And of course, at the same time, you've been a medical student of sorts yourself on the ACRRM pathway. What can you tell me about the pathway, and what have you learnt from your perspective as a GP registrar student in inverted commas?
Yeah, we're always students, aren't we? I think the learning never ends, and I think that's a great thing. The ACRRM pathway, I think, has been incredibly valuable to me for a couple of reasons, but I do recall a couple of moments early on when it came to the fore. I've been a doctor for a number of years now, so sort of not quite fresh out the barrel. And I think when I joined the independent pathway, which is obviously for sort of later on in your career, you join a group of people who have gone through the ringer, so to speak. So perhaps they've gone through a specialty pathway and come out of that for some reason, or they've gone through personal challenges. And again, I think it comes back to that humanness of people who are keen to involve themselves in rural practice, and particularly generalism. So I remember the independent pathway, they have a workshop, which before COVID times was up in Brisbane, all together face to face, and it really left a mark. I remember listening to the stories of other people who had come from other countries and then dedicated themselves to a small rural town, or had come out of a specialty pathway and had a really challenging personal time. And I think it was that process of finding, their own identity as a doctor, but also having gone through challenges and come out the other side that really stood out. And I'm certainly no different. I think anaesthetics training was a wonderful aspect of my career, but also very challenging, and certainly had some personal sacrifices along the way.
And in terms of the supervision approach as a GP registrar, what have you taken away from your interactions with your own GP supervisors?
Oh, look, it's amazing. I mean, I'm very fortunate to have had some incredible supervisors, both from my clinical GP placements and also in an academic sense, and they've both been very supportive. So Professor Lucy Walters, who's a past president of ACRRM, has been an academic mentor of mine, and she's certainly involved me in things I never thought possible in terms of getting involved in rural medical education and some research, which has been great. And secondly, the clinical supervisors have been wonderful. So Dr. Adrian Christie and Dr. David Adams at Anguston Medical Centre and others, and Dr. Amanda Bethel at the Royal Flying Doctor Service. They're all incredible rural doctors in their own right, and certainly been in their own communities for a long, long time. So being able to talk to them, particularly with challenging scenarios, and they've been very supportive in terms of getting me through assessments. And again, I think that's one of the things that can't be underrated, is that it certainly have to be very motivated to get through your assessments, but it's all worth it in the end.
I'm interested in talking to you about your research because you have a keen interest in student welfare and you've undertaken research into work readiness in medical interns. What have been the key findings of that research, and did your interest in these areas come from personal experiences?
Yeah, certainly. The interest came from, I guess, combination. So work readiness was something that came through in some national workforce initiatives looking at internship models, and the general question of is how ready are students once they graduate to jump into an internship. And what came out of it was reasonably poorly defined, and it's sort of been benchmarked as a set of skills, if you like. So what I did with some colleagues through Flinders University and others was to look at the research that's been done on this sort of term in medical training over the last 20 years, get all those studies together and see if we could come up with a sort of outline of that. And generally, I guess the take-home message is that it's not just a set of skills, but it sort of encompasses three different things. I guess in an individual, it's about the confidence that they might feel in going to day one of internship. There is an element of competence, so what skills have they acquired, but also what context have they trained in, and students either train in metropolitan areas or rural areas, and has that made some difference? And I think that, so in general, there has to be a holistic concept of supporting students in those first transition periods. And the same goes for any transition period, whether it be from pre-vocational training to GP training or out the other end as a new fellow and consultant. So I think there's certainly going to be some active area of research in the future. I think certainly from a personal point of view, and a lot of interns and doctors can relate to the feeling of surviving, not thriving in that first year, and also an untold hidden curriculum, if you like, of, feel free to cope. And certainly that was my experience even 10 years ago when I was doing internship. And I think you sort of tend to take it on the chin and just move forward. But unfortunately, some people do really struggle. And I think the last few years have really seen a huge emphasis on understanding doctor wellbeing and junior doctor wellbeing, which I think is absolutely imperative because it is a community and we are human after all. So I think it's really important to be able to support each other through that. And the same goes for comparing. I've often sort of compared different fields and arenas, such as, you see sporting stars in the media being able to share their struggles with mental health, and it is better, but it is rarer in medical communities. And there are some important champions like Jeff Toogood and Nikki Stamp, who are both, specialists in their own right, very accomplished, but have openly shared their own dealings with well-being, mental health, and gender inequality in medicine. So I think the more sort of champions we can have of that, the easier it will be for the next generation coming through to understand that there are support structures around and it's okay to go through those things.
You mentioned there has been some movement in terms of intern support over the last couple of years. Do you think it's gone far enough, and what else do you think needs to be done in this space?
Certainly, yes. I think that it's been fantastic, and there's been a huge amount of advocacy both at the national level and individual hospitals. I think when I was a decade ago, I was involved in one of the near-peer mentoring programs at our hospital in Sydney, and that was sort of just starting to come through to the fore. And I think those mentor-like programs have certainly come in through a lot of the specialty colleges. I know anaesthetics have a really important one. ACRRM has a mentoring match program now as well. So I think those things are fantastic. I think there are still, unfortunately, still the stigma around struggling with mental health issues in medicine that is difficult to match up with our professional obligations sometimes, and being able to openly share those struggles. So I think it is a difficult area. But I think the more conversations we can have about it on a one-on-one level, the better. And I think that the system will change slowly over time.
You've also taken a role in mentoring Aboriginal and Torres Strait Islander medical students. In what ways, in your view, has their journey to becoming a doctor been more difficult, and how can improvements be made in this space?
Yeah, I've been involved with Aboriginal medical students for a number of years now, and I certainly don't feel most qualified to talk about this, obviously being non-Indigenous, and I think there are very, very many important people who are able to speak to this. But I certainly think it's an important area. I think number one, as an individual level, being able to be educated about the Aboriginal and Torres Strait Islander culture and issues, particularly as they go through for students trying to get into medicine and going through that career pathway. It is so important. A turning point for me was going to one of the AIDA conferences a few years ago and witnessing firsthand the issues that were brought up by students and junior doctors there. A huge issue that I remember was raised was about mentorship and having a partner in that process, and the importance of that mentor being from multi-generational. So, often elders were involved in that and people who had gone through and helping those beneath them. I remember a circle of conversation done in a circle, and that element for me was completely flattening the hierarchy. It doesn't matter what level you were, being able to talk one-on-one across from each other and share those stories, which I thought does, it is a bit different to our traditional, you go to a conference or something and there's someone up the front and everyone's sort of looking down. It's a really, and I think those things we can learn a lot from. I think the way we structure our medical education models are certainly very much based on westernised Anglo-Saxon traditions, and I think we could learn a lot to how we're going to incorporate the aspects of different cultures in our own Indigenous culture in Australia to how we learn medicine. I think that's a really important step. And also, there are a lot of good educational platforms out there to educate the broader medical community about Aboriginal and Torres Strait Islander learning through medicine that will help medical students coming through, such as the Lyme Network. And there's some excellent podcasts being developed, particularly by one of our colleagues at Adelaide University, Andrea McKibbett, called Healing Conversations, which is really wonderful to sort of see and to listen to.
What's that podcast about? Is it around cultural sensitivity, cultural awareness?
It is. It's some fascinating conversations with people who have been in the field for a long time, such as Professor Lylan Bandler. And Dr. McKibbett has those conversations about both what patients from Aboriginal and Torres Strait Islander communities value in medical settings, such as the value of silence in clinical conversations, but also educating medical students, no matter where they're from, about those issues. I think it's a really great thing, and we certainly would recommend them.
Tell me about the value of silence. It sounds really interesting, and is it something you bring into your own practice as a GP registrar?
Absolutely. There are some learnings that I've taken from my interactions, and number one is finding out about the person, not only where they're from or what country they're from, but I think that's important for any of our patients, and I often like to start consultations with a bit of discussion about who they are and what's involved in their lives, rather than starting off with why are you here today, which I think is equally important. And the value of silence, from my understanding, is about the importance of creating space in consultations to allow patients to feel that they can open up about why they're really there. And I think certainly that is an important part of our general approach, but even more so for Aboriginal and Torres Strait Islander patients.
Is there room for that in the current 6-minute medicine model of practice, do you think?
You make a great point, Patrick. I think there's a quite a distinct imbalance between the time afforded to us by our the system we work in and the time that we actually need with patients sometimes, and I think that's a disparity, and that is something that I know has had a lot of discussions about at state and federal level, and I think it's so important to get right, but I think it's going to take a lot of work.
You've also talked about the concept of wish they knew, medical students and junior doctors who otherwise wouldn't have gone to a rural area, having gone to a placement and going, oh, I wish I'd have known about this earlier. Are we collectively doing enough to encourage medical students to consider rural medicine at an early stage of their training, and what else can be done?
Yeah, absolutely. So it's amazing, particularly students who would not think of themselves as enjoying a rural placement. There are lots out there. There are lots of students who say, "Oh no, no way, I want to go to Whoop Whoop to do my GP rotation," and they come back, even if it's short-term placement, 6 weeks, thinking, that was amazing. I wish I knew about that before. So I think why they love it so much is, as we mentioned before, they get quite a one-on-one approach to their teaching, which students love. The supervisors know their name, they're involved, they're up the front, assisting in caesarean sections or in emergencies. They're actually quite hands-on, and that's an element that students really value. And I think rural clinical schools do a really great job, particularly those schools that encourage students to spend quite a period of time in their medical degree in a rural area where they really get to immerse themselves. So there's longitudinal placements, which are not just short term. And I think there's a lot of encouragement early on at that level to consider rural careers. I think that the gap does come in the early pre-vocational years, where there's a couple of things that not everyone gets to experience what it's like to work rather than just be a student in the rural environment. And secondly, the exposure to rural general practice or general practice in general. So I think those elements and are missing as soon as you graduate. There's not always the opportunity. For example, intern years are mostly hospital-based, and often PGY 2 years. It's difficult to jump into a general practice term at that stage when you have to apply for the contract halfway through your first year, and you may not have had much exposure. And so I think that certainly that there is a gap there. And once again, I think that's being strengthened. For example, in South Australia, we're developing the Rural Generalist training pathway, or the state government is, in consultation with other bodies. And I think that will strengthen the pathway for students to see what a rural generalist career would look like. So certainly I think things are being done. And at an individual level, I think there's no shortage of passion in rural doctors or rural supervisors. And I think there's certainly some gaps in terms of exposure in the early pre-vocational years for a start.
I'm keen to hear a little bit about your day-to-day practice as a GP registrar, and I'm assuming you do some anaesthetics as well in the mix?
Yes, I do. So I know how I'm going to describe it. You'll sound like jumping from here, there, and everywhere. But I guess I have had to balance the last couple of years being both a doctor and I'm also a father as well, and a single parent. So I've had to balance that out in some ways, and getting that right's been challenging. So currently my clinical work involves the Royal Flying Doctor Service, so up in central operations with Port Augusta. And a typical day is a lot of the day is spent on the phone, talking to patients who are very, very far away, needing medical help, and that's a really fantastic feature of the job. And the other fantastic feature is obviously flying out to help patients who are in distress or with emergency cases. I do spend some of my time in anaesthetics, so that's a great feature as well. So I do some work in Port Augusta in the north and also locally around Adelaide with rural GP anaesthetics. So I get the chance to assist with caesarean sections and doing the spinals and helping patients through that wonderful, wonderful time, and also with general and emergency cases as well. And then thirdly, I get to be involved in education, which I love. So either teaching in workshops, teaching students about anaesthetics or scenario-based teaching. Obviously, with my work with Adelaide Rural Clinical School, involved in mentorship and career guidance, and also with coaching students through their own learning. So I think that I'm feel really privileged to be able to have that balance. I was working in Angaston for the last year, and I've just finished up there recently, where I was able to be part of the community. I spent several days a week living and working in the community before other responsibilities, doing on-call and working with patients in a clinic setting. And I really love that as well. And I think that's that's the best thing about rural med practice, is that you can create that variety and create that balance that works for you. And I think that's a really important part to pass on to the next generation who are going to have priorities such as some balance in their working and family lives, and also the need for part-time work at times.
Have there been any patient encounters or situations where you've had an aha moment and thought, wow, this is why I do this work, this is why I'm undertaking my GP registrar years, this is the rewarding bit that I've been seeking in my medical career?
I think there's several. Just from my recent experience, recent times in the Barossa, I think particularly coming from a very practical training pathway like anaesthetics, where there's a different element of how you interact with patients, and often it's very brief. So it's a very important part of having to place ask a patient to place trust in your hands for what you're about to help them through, in terms of giving them an anaesthetic and getting them off to sleep or relieving their pain. And I think that's amazing. I think working in a general practice environment, for me, the importance of listening and the privilege of just being able to listen to patients has been something I've taken away. I think that for me has come to the fore a lot. For example, often as a young doctor, you feel like you have to do something. And I think as you get more experience, sometimes the value is just in being able to demonstrate some kindness and have a listening ear. And that is very valuable to patients. And sometimes you're rewarded. For example, a lovely farmer came to me with a very concerned neighbour, and he'd been sort of fobbed off a couple of times from some other practices that we weren't affiliated with, but he was a bit more distant. And to me, something wasn't quite right. I took some time and listened to their concerns, and ended up having a significant heart valve issue that we, had an operation the next month. So for me, stepping back and being able to just take a bit of time, and again, with the pressures of an everyday practice, that is difficult. But the value of that to me, and really sort of helped him through that period of his life and relieved a lot of his symptoms, was fantastic. So I think, being able to listen, and likewise, people going through their own struggles, particularly in COVID times, just being able to be there and help them through that time was a great privilege.
Do you find the approach of taking the time to listen sometimes makes it difficult to push through with the worried well? Do you find that sometimes you really need to make yourself listen, where otherwise you might go, oh, I don't think this person has a major problem? Do you think you still need to make yourself listen and try to get to the point, as you did with that other patient, where they have a significant issue?
I think so. I think that, again, I think it comes back to the fact that doctors are human, and we don't always have good days, and we don't always have the energy to approach a day with our best version of ourselves. And I think that's a hard thing for patients to understand, having been on the other side of the coin as well sometimes. And being able to sort of switch on to that caring and listening side is not always easy, particularly when sometimes you feel like you're dealing with sort of minor issues. So I think for me, how you do that, and firstly, it's acknowledging that doctors are under a lot of pressure, both in terms of their time and their commitment to their communities. And more often than not, they're doing that with absolute dedication. And patients don't always get to see that side when they're up all night and then in clinic the next morning. Being able to switch that on, I guess, is the difficult thing, and that comes with experience. It comes with good family supports. It comes with realising that we're human, need to eat, sleep and exercise and have social interactions ourselves. And only then can we really sort of do our best. I think that certainly for me, often if I'm struggling, and I'll try and put myself in the position of the patient who may be uncertain or fearful or in pain, and I try to sort of think, for them, they are uncertain and anxious, and they don't know what's going on. So I try to put myself in their shoes, and it really helps. And I think that's sort of got me through a lot of times when I'm tired and I'm not sure, about what to do. I think putting yourselves in their shoes, I think, is so important.
You just mentioned the need to look after yourself as a doctor, to be able to work at your best, and you also mentioned you're the dad to 2 young kids. What strategies have you used to juggle work and life as a doctor to get that balance right?
Yes, so I put my hand up. I'm not very good at balance. So I'm probably not the great example, because but I think it's a really valuable thing, and you can only really get through after a lot of practice and time. Yeah, I've got two kids, so Charlie's 6 and Emmy's 4. Yes, I've been a single dad for a few years, so it's certainly been a challenge. I think for me, I've had to create some dramatic changes, having gone from full-time shift work to the privilege of having been able to do a career and in training where it does value some flexibility and at times part-time work. And thanks to ACRRM for that, because they have enabled that and allowed the support structures in place to make that happen. So it's a really valuable thing, and not saying all colleges don't have that element, but it is not always easy in other spheres. I think for me, it's been a double-edged coin, or double-sided coin, being a single parent, because now when I'm with the kids, I don't have any other distractions. So I'm just for them when I'm with them, and I think that's definitely underrated, because not everyone gets that chance when they're busy and they've got other people in the household who can take the balance. But yeah, for me that's been great. So I can just spend that time with them, and that's been awesome. And I think that it is important to have hobbies and to be able to have an outlet for stress and challenges. So for me, that's music and other things, other sport and things like that. So I think that's so important to be able to have.
You mentioned music. I know you enjoy playing guitar and doing some songwriting. Tell me a little bit about this.
Oh, look, not very good. But I think my starring moment was in the medical review during medical school. I think I was in the band for them. I think I co-wrote a song or two, and it was
Right.
it was a bit. I think it was a hit, but it was a great review. It was called Rash, so we always did a pun on the name, so that was based on MASH. So it was a very
Right.
sort of army theme. It was fantastic, and I really loved that. I played guitar, and so I've always been. I did music at school as well, and always enjoyed that. And I'm just doing some songs at the moment with my best mate, who's a drummer. So watch this space. You never know.
So what style of music are you into?
Oh, I went through high school in playing piano and doing classical music, so which I always loved. I think that's beautiful composers, and music really speaks to you and speaks to us in different ways. But at the same time, I guess it reflects my generalist career. I love variety, so I love a bit of rock, heavy metal. Grew up with Aussie bands like Powderfinger, and also love American Foo Fighters and those guys as well. So yeah, a bit of everything. And how can I not mention Paul Kelly, of course? So
Absolutely. You've got a diverse range by the sound of it.
yeah.
You also enjoy getting out and exploring remote coastlines when you've got a chance. What have you discovered on your travels along Australia's coastlines, and what part of the coastline really stands out as being a favourite?
I think in Australia we're just so fortunate to be able to go somewhere and have no one else around. I think that's pretty rare in the world, when you can go somewhere when it's so remote that you feel like you're the only one being able to witness it. So I certainly remember times, the coast of New South Wales. We, after school, my friends and I, we always had road trips up there, up to the Byron coast, things like that. In Arnhem Land, was lucky to go out to Cape Arnhem with the local family. Again, just camping by the side of the ocean, careful for crocodiles and everything, but that was wonderful. And then South Australia has been absolutely remarkable for me. Places like the Eyre Peninsula, York Peninsula, and down towards Kangaroo Island. I think they're just really untouched wildernesses, and have so much to offer us in terms of restoring our own spirituality, and restoring us when we need to go back to a busy lifestyle or whatever else. So yeah, having the chance to go out there and just camp under the stars, and it's been magic.
Looking forward 10 years, where do you see yourself as a doctor? Where do you see yourself living and working?
Oh, look, I think big questions, and I suppose I've never been a planner aheader. So I guess 5 and 10 year plan for me sometimes is a bit hard to do, but
Right.
as you could tell. But certainly South Australia feels like home. I think having moved around a bit when I was a kid, I sort of sometimes felt a bit out of place, but I certainly think here just feels like home. So I really hope that I'm still in this state. I think that, and I always just wanted to be a good doctor. I think not necessarily, the best, but I think it's really important just to aim to be as good as you can be for your patients. And I think part of that is feeling satisfied professionally. So being able to have some variety in your clinical work, which is great in rural generalism because you can have that variety, and also include education in that and giving back to the next generation. Being able to teach in your day-to-day job is so valuable. And then, of course, enjoying life and having family time, playing music and taking a holiday, which hopefully we can all do at some stage.
You might be zooming in from Nashville in 10 years' time.
Playing alongside Keith Urban.
Yeah, that's right. Well, James, congratulations again, and thanks very much for speaking to us today. And that was Dr James Padley, the ACRRM-RDAA Rural Registrar of the Year for 2021. I hope you've enjoyed this podcast, and I look forward to having you tune in again. Until next time, happy days.